Hey, good afternoon, viewers. I'm your online host, Edmund. Welcome to the second day of the SATA CommHealth Osteoporosis and Fall Prevention Festival. Our next esteemed presenter is none other than Ms. Siti Zubaidah Yusoff from SATA CommHealth. Zubaidah is an occupational therapist who holds a master's in advanced occupational therapy from La Trobe University, Australia, and a master of public health from the National University of Singapore. She is currently heading the rehabilitation services in SATA CommHealth, where she spearheads various projects that integrate and transform healthcare service delivery with technology. Zubaidah will now speak to us on frailty and the community. Kindly note that questions will only be addressed by the speaker at the end of the talk. Please utilize the built-in Q&A function to pose your questions. Okay, I'll hand the stage right now over to Zubaidah.
Thank you, Edmund. Hi, everybody. Thank you so much for spending your Saturday afternoon with us. It's 12 p.m., so it's lunchtime for some of you. Hopefully, we get to end on time and, you can go up and have your lunch. So like what Edmund says, I will address all questions later on at the end of my talk. Do use the Q&A section or the chat box in any way that you feel convenient or comfortable with. I'll try to go slowly because some of the content can be very technical or scientific or too much for the healthcare professional. But other than that, if you feel that you're confused or not quite sure about certain terms, please feel free to ask me later on after the end of this session. So today I'm going to talk about falls and the community. So let me just go through what will be the things that I'm going to cover today. First and foremost, how is it important at this day and age with regards to our aging population in Singapore? And how does this falls or the component of falls affect the population? What is the projected cost and of falls and the preventable falls? So what are some of the risk factors of falls so that everybody, or if you're a caregiver or even your child, you are aware of the factors that may affect your parents in future or what you will actually experience in future yourself. So one of our key components is also the various efforts that we have with the various community partners. I'm going to introduce as well the Aspire program that we collaborate with Sengkang General Hospital. And lastly, the Strong Bone program, which we got funded for, which was worth 250,000 by the President's Star Challenge Fund. All right, so first and foremost, I'm pretty sure you've all, if you read the papers, a lot of articles thus far has been covering a lot on aging, mainly because in 8 years' time, by 2030, 1 in 4 adults or 1 in 4 of us in a group will be of the age of 65 and above. That's 25% of Singapore's population. So if you were thinking about it, 8 years, but it sounds so long, but actually it's not, because there's a lot of things to actually work on. And out of that elderly, if you have 3 elderly in a group, 1 of them will actually suffer a fall, and a very drastic consequence will arise from it. So there's evidently going to be an increasing number of falls in the community. I mean, given the fact that Singapore is aging, and that even 1 in a group of 3 elderlies will suffer a very bad fall, right? So that's something that we have to prevent or do something about. So why is it important? I mean, I've already mentioned it just now, because 25% of Singapore's population is expected to be 65 and above in 8 years' time. And not only that, Singaporeans are also living longer. So as you add on, we all age as the years go by. So as you add on the years to your age, this pool of people also increase, because Singaporeans' life expectancy has grown over time. So it has gone up by 2 years. In 2011, it was only at 81.9 years, but last year it's 83.9. So we are expected to live longer. So unfortunately, injuries account for 11% of disability and early deaths. So out of this 11%, 6% is attributed to falls, right? So if falls can be prevented, why don't we address it earlier in the day? So I'm going to give you a bit of the numbers. Why is it important? Mainly because of the cost. As you know, we are also experiencing an increasing cost in our livelihoods. That's also true in terms of healthcare. If you were to see the number of indirect costs, is in 1998, people who suffer from hip fracture are expected to spend 17 million in 1998. But as the time goes by with inflation and everything like that, Singapore is expected to spend 145 million USD in 2050, right? And if we're to see in terms of the number of falls as well, it will be increasing. It projected that it is going to hit 9,000 by the year 2050. So it's very, very important to prevent falls wherever possible and do some exercises to keep you fit and going. So I want to talk about the risk factors of falls as well. So as you can see, there are a lot of factors going on here. So one of them is actually stroke or some form of head concussion, where if you have stroke and if you did not have any form of rehabilitation, that is also going to put you at a high risk of falls. Some aches and pains of your joints, when an elderly or an individual don't have good sense of balance, that's also something that will attribute to a fall. When you have poor eyesight, so it's also important for you to go for your health screening, go for your eye check, and things like that, because poor vision can also lead to a fall. Apart from that, it's a lot of polypharmacy, or in that sense, taking various medication. So if you have more than 1 or 2 medications that you are taking in a day, that's also a high risk of falls. Last but not least, obviously, is the osteoporosis or osteoarthritis that you experience where your joints or the laxity of your cartilage deteriorates over time. Yeah, so these are some of the risk factors that actually put you at a high risk of falls, and something for you to note, because some of these things are preventable. So I'm going to touch on the various efforts that SATA has involved in over the years. We've actually touched on, we had touch points with shopping malls where we put a sit-to-stand kiosk, which I'm going to talk about later on. Why do we do that? It's a preventive or prevention tool where you can actually see your risk of falls. And why did we go to a shopping center? Because that's a place where people gather, have food and explore and have fun. So it's a very good place for preventive education and preventive health to happen. We've also collaborated with Sengkang General Hospital. That's where they refer clients to us, or they refer seniors to us, so that at Fernvale, one of our centers, so that we are closer to the community, then seniors and patients and everybody else don't need to come out, right? Especially with the pandemic, where people try to limit their travels. So they will be able to find a clinic that's more easier and accessible for them to reach out for assistance or help. We also do community outreach and collaborate with various religious organizations, which I'm going to touch on later on, what and how that has been going on so far. So this is what I've shared just now. This is a sit-to-stand kiosk. It was positioned in one of Bedok Point, where there's a challenge where you have to sit to stand, and how many of sit to stand can you actually do within a time frame of 30 seconds. So once that is done, you'll then be categorized under low risk of falls, medium risk, or high risk, and a formal assessment will then be followed up by a therapist. So from that kind of screening assessment, you will then be referred to our falls assessment clinic or our SATA clinic, where we can actually assess you further in terms of your balance, mobility, muscle strength, as well as reaction time. So I'm going to show you some photos of the event that had happened. I mean, of course, this was pre-COVID. This was sometime in 2018, 2019. So that's where everybody came, and then we had a full falls prevention education program where people had a chance to see and assess their risk of falls and where they were at. Okay. So the next one was a collaboration with Sengkang General Hospital. One of the reasons why we took this on is because we want to be in a movement together with Ministry of Health as well as the hospital to move beyond hospital to community. Mainly because it's to enable access, like I said, to seniors and citizens for health services within the community, also to reduce your waiting time for the public, and you get to receive early intervention. So the purpose is to ensure continuity of care that's available to the seniors and not only wait for intervention to begin at the hospital. So sometimes, waiting time could be long. So that's one of the reasons why Sengkang General Hospital also collaborate with us. So the center that we collaborated with is at Fernvale, is really under or nearby a block estate and opposite a multi-purpose hall. And the program that we collaborated them with is called Frailty. So this is where a lot of falls assessment or frailty intervention takes place. It is done by a multidisciplinary team. So it's not just by doctors, but it's a comprehensive assessment done by doctors, nurses, physiotherapists, occupational therapists, speech therapists, dietitian, and also social worker. Because we believe that, as a person, you are complete as a whole, and medical is just part of the component, but there are other factors that also affect falls, like I said just now, poor balance, pain and aches of the joints. So that's the reason why we have a multi-D approach rather than just a single profession approach. So the team will meet every 2 weeks, and it's not just within the SATA team, but also a meeting with the Sengkang General Hospital team to ensure, like I said, continuity of care that was done between both institutions, so that the patient is attended to well throughout their process with us. So one of the things that we actually do was a pre and post test. So pre is before the program, and then post is after the program. So the data is still ongoing. So I've just extracted some of them who've completed the program. And based on the time up and go, if we were to see there was an improvement, especially for the moderate and severe group, they've actually moved, from severe to moderate and so on and so forth. So this is actually one of the good things about Aspire, where you see your patients improving within the community itself. Now, the next one is within the community outreach with our community partners. We felt that it's very important to reach out to the community, because that's where a lot of socialization, gatherings, and events takes place. And being Singapore, where it's religiously diverse country, SATA also believe that we have to reach out to these various communities at large, even places of worship, to ensure that communities are not left out in their preventive care. So with that, SATA got a fund from the President Challenge, and we've actually done our reaching out or outreach program for falls prevention and osteoarthritis and osteoporosis talk to one of the mosques in Singapore, which is Darul Makmur Mosque. So for SATA, we actually are championing this bone health as well as falls prevention throughout island-wide. And we are working to get more partners on board, as also working with other partners on board to expand this effort, so that the seniors in the community, which is what I shared just now, being Singaporean, the Singapore aged, we can ensure that services are rendered well and complete to our seniors. So this was the fund that we got worth 250,000, just to let you know that SATA got the fund from President Challenge. Why? I mean, I've already shared it with you before. Falls are very common among seniors, and it can lead to a catastrophic event like hip fractures, knee fractures, and so on and so forth, when in actual fact, falls are preventable. So the programs that we're running, the main objective is increase awareness on the importance of bone health. Like I said, it's a very preventive program where the doctors come in, a therapist comes in, and we assess your balance, your eyesight, your aches and pains, your house, modification, and things like that, what is needed so that we can prevent falls for you. As with all things, early detection is very important through intervention. That's why we need to screen you and provide relevant treatment accordingly. The clients, I think I've said it before just now when I started this presentation, mainly seniors in the community. Despite the fact that you may think that you're healthy or fit, I think it's worth the while to check your falls assessment as well, like your health screening, right? Health screening, we do it every year. So having falls assessment screening every year will be actually useful, mainly for vulnerable seniors as well as frail seniors. So, I mean, we talked about early education, prevention. So I'm just going to share about the framework that, that help guide this program. So we based it on EASE, EASE meaning education, assessment, screening, and treatment. So what do I mean by that? So this program actually aims to enhance public awareness and knowledge of falls prevention and osteoporosis, which is exactly one of the reasons why we're having a falls festival at this moment. I mean, because of COVID and the pandemic, we can't have it in person, but that's why we shifted online. So hopefully this is also beneficial for you guys out there. Assessment, it is very important for the clinicians to assess where you are at baseline, as with all things, to see where you're at, and then how can we then help you to go to where you should be. So we use validated assessment tools such as Sit to Stand, OSTA, and to identify, especially to identify seniors at risk. I mean, I've mentioned a few assessments just now. Time up and go is one of them. 30 seconds Sit to Stand is also one of them. Screening, we offer BMD, so that's a bone mineral density test, and we also assess you based on your muscle mass test or MMT for seniors who are at risk. And treatment, like I said just now, it's not just doctor, it's not just nurse, it's actually a holistic treatment that we provide with both medical therapy, dietitian, as well as the nurse. Yeah. So SATA CommHealth services is actually quite comprehensive. We have medical service, we have diagnostic service, the lab service, rehab service, home care as well, and the active aging service. So I think given the fact that SATA has grown over the years, we're very glad and hopeful that we are able to work with various partners to even extend our help and services to other community partners out there. So this is my last slide. I'm just going to share and summarize what exactly will be SATA be doing in future and what is our main philosophy. I think I've said enough in terms of we actually assess, screen, provide treatment, and track and provide follow-up for our patients. And we also do other services in terms of Screen for Life as well as vaccination. We have a strong bone app, and then this is on pilot. So it's actually currently piloted at Fernvale. So that's where the Frailty program of Aspire is happening. It's an easy to use app to actually conduct falls assessment. So hopefully if this is successful, we can roll it out with our partners, and with all the apps that you have in your phone, you can just download it and then screen the falls assessment to your parents or even to yourself. Yeah. We do a lot of collaboration because we don't believe that we can provide a successful intervention all just on our own. So we've collaborated with social service agencies, grassroots organization, religious organization, as well as corporate organization. So hopefully in future, in a way where we hope to sustain this program is to empower seniors, because we believe that you can learn only so much, but it's more of educating you and how do you then make the best decision out of all the things that you know to move you forward, right? We also hope to tap on volunteers to conduct more programs with the assistance of the social service agencies, because you'll be surprised where sometimes even though we have these programs with partners and other organization, there are times where there are seniors who also fall through the cracks and are not receiving this kind of services, either because they cannot come out of the house or they have no money for transport and things like that. So hopefully we do hope, and also we do wish to push this movement to work with more partners to reach out to more seniors who are vulnerable and frail as well. Okay, so I think I've come to the end of my presentation. I see a few chats on the box. I'll address them now. Let me just have a look. How to participate in the Aspire program? Okay, so hi May, thank you for the question. So Aspire is in Fernvale, so you can always Google Fernvale Community Hub. So it's somewhere, I think around block 400 plus. How do you get it? You can actually get a referral from the SATA doctor to refer you because, and then they say that you would like to be a participant and register for the Aspire program. So we do need a doctor's referral because the doctor will then screen you to see which level of frailty you're at to assess whether you're really, really frail or are you pre-frail. Or if you're asking this on behalf of your mom or your dad, then all the more to see where are you at in terms of the frailty scale. Right, so Cindy, hi, thank you for your questions. BMD screening done at what age? Is it accurate? How about DEXA? What's the difference between the two? Oh, this is such a good question. Edmund, do you think, I don't think I'm a good person to actually answer this. Is Edmund there? Edmund?
Okay, sorry, Zubaidah, I'm having some trouble with the video. Okay, I will announce the hotline number for them to call. I think I've done that periodically. So they can actually call that number.
Yeah. Cindy, I'm not in a good position to answer you because this is usually answered by a doctor. So could you just inform them on the chat or at the question where they can actually know the hotline, Edmund?
Okay, SATA CommHealth's hotline number is 6244-6688. I repeat, 6244-6688.
Cindy, you got that? If you got that, could you just reply me and say yes? Seems like these screening programs are only for North Sengkang area, not for other areas like South and West. It's actually a pilot program. Thank you, OSK. So we want to see the success of the program first before we roll it out to other parts of Singapore. So yeah, for now it's at Fernvale because that's where it's a bit more intergenerational and we want to see how we can work towards expanding it. Yeah. Okay, May, must one get a referral from SATA doctor to attend Aspire program? Yes, because right now the only way to get through Aspire is either by SATA or from Sengkang General Hospital. We haven't exactly opened up the program to the public. That means to say the other GPs. So we are actually trying out and testing out a pilot referral program with other GPs. So I think a few GPs are coming on board. So having said that, for now, currently, yes, it's only for SATA doctor. So you can also see the SATA doctor at Fernvale. All right. Okay, Cindy, thank you. May, are you okay? Are you good? Anybody else have any questions? Okay, so Edmund has actually indicated the email address over there. So it's media at the chat box in case you guys are wondering. It's mediacontact@sata.com.sg, or you can call the hotline at 6244-6688. 6244-6688. Okay. Okay. Thank you, May. So good to get questions from you. Any more questions, guys? So maybe just have a few of the audience. Could you just put in the chat box maybe which kind of, where do you all live? I mean, I see from OSK that he wants the program to be expanded to the South and West. Are you looking forward to the Aspire program to be in the West or South? Where do you live, OSK? Oh, he has left the building. Okay, we still have some time. Oh, living in the West, right? Hi, Rosita. How are you? Okay, Rosita is my ex-colleague. Okay, so in the West, of course, living in the West. Okay, yes, we do have a few centers around Singapore. And hopefully, if this is successful, then we will expand the program to the West. Have you guys had, I mean, I think one of the things of Frailty is that it's very good to identify it early. You may think that, oh, I'll get this done at the age of 65, but it's actually advisable for you to just get your muscle checked at the age of 60. And you know that things like this, preparing for aging, you can start as early as 50s and 40s. There was an article. Why do I say that? Because there was an article, I think in Straits Time a few days ago, where they said that there's a lot more Singaporeans actually getting stroke at the age of 30s. Yeah. So I am not surprised if I get frail patients who are as young as 50s or even 40s. We do have patients who are very frail, where the bones are a bit brittle and not so well, as young as 45. I mean, it's unfortunate, but it is increasing. I think one of the reasons is also because of our lifestyle and the food that we're eating and the diet that we have. So I think if you had followed us through the festival, you've noticed that you've of course had a talk with Minchu. Minchu is our dietitian, where she actually educates about what do you call that, about what kind of food should you go for and what's beneficial for you, especially when we're aging, right? And you'll be surprised that such things actually take a long time to manifest. So it's very, very important for you to look after your diet as early as now, or if you're in your 30s or your 40s, please look into it. Yeah. Can residents living in the West and Central access SATA program? Are you referring to Fernvale? Is that what you're referring to? Could you just check on a box for me and let me know whether that's what you're referring to? Is it particularly Aspire? Oh, yes. Okay. So far, let me, I cannot say, because usually I think we we don't, what do you call it? We don't reject clients. But the thing about Aspire is that it's specifically for the area in itself, because we wanted to do population health. So if this model works, then we will expand to different areas. But if you do want to attend this program, just do give us a call, and then we'll note your interest. And then, because Aspire program is also something that Sengkang General Hospital offers with other partners like St. Luke's, St. Andrews, and you'll be surprised that maybe they're available at where you're at, and then we can look into that, into referring you to another Aspire program, but not under SATA, but it could be something with Sengkang and St. Luke's, or Sengkang and St. Andrews. So do give us a call, and we'll help you out, all right? Or drop us an email, and then we can reply you accordingly and give you the relevant resources as such. Okay. Okay. Right. So any other questions? Any particular thing that you'd like me to go through? Was the presentation clear? Just to also update, let me just share the screen again. Let me just share this again. Where are we? Okay, so we wanted to expand as well our community outreach. So apart from the mosque, we are also trying to work with St. Hilda's community services to reach out to more communities. So, I mean, because of the pandemic and restrictions, there's been a lot of movement restrictions. So it's a bit hard as well for us to go in, understandably. So hopefully next year, when restrictions ease, then we can open up and then partner, and then finally, accelerate a few things, right? Elena, there's a contact that Edmund has shared. So if you have a particular questions to me, just email it over there, and then they will direct it, then I will answer. Yeah, so it's mediacontact@sata.com.sg. Maybe I should put it on the slide. Give me a moment. Here we go. So that everybody is aware. (6244-6688). Right. Okay, let me just increase this font right here. Here you go. Okay, let me just keep this where it's at so that you guys know who to call and who to email to. Okay, I see a lot of questions coming in. Yay! Sit to stand kiosk only in Bedok Point. Any plans to expand to malls in West region? Okay, expansion is something that we will need to discuss with the Business Development Office. I think one of the things that we are looking at is also partnership with other community partners. There was a time where, I mean, with pandemic and everything like that, I think there are also, shopping malls are also very worried. I mean, after all, we're not supposed to congregate as a group, right? So I think that was one of the reasons why we decided to take it back. But if there are interests as well as needs over in the West, why not? Rosita, you want to work with us to actually put Sit to Stand kiosk over at your side? Okay, Rosita is my ex-colleague, so she's a nurse, so I know where she works. You can drop me an email. Elena, welcome. Hope that this will help you with your email and connections as well. Okay, I'm just going to go through the services slides. Can I have what else do you guys need? Okay. So I'll answer all questions. I'm also going to showcase the kind of various services that SATA provides. Maybe I'll just go into that a bit more since you guys want to know. I mean, I've got a question that asks like, what are the various services that you provide? So apart from medical service is quite broad. We do health screening. We do normal, GP clinic. We also do employment, check as well. Diagnostic services like BMD, X-rays, lab service, which I think blood tests and things like that. So rehab service is fairly new. So that's where I am heading, or where I head. So rehab services has been going around for about, I think now 3.5 years. So we have occupational therapy, physiotherapy services that we provide. So apart from just the center-based rehabilitation program that we provide, we also provide home visits to your house. So what it means by that is that if, say, for example, when your elderly fall down, the OT or the occupational therapist will actually visit the house, see what kind of grab bar is needed, where to install the grab bar, and whether you need a ramp, and all sorts of things. So you'll be very surprised, especially for those of you who are living in a very old flat or old estate. There's no grab bars. Sometimes the floor is a bit moldy, or there's no ramps, and the old toilet actually has quite high curbs. So recently I went on a home visit, and this estate has 2 different toilets. So this particular house has 2 different toilets, one to shower and one to pass motion and pass urine, and both the toilets has a curb. And this patient of mine is wheelchair bound. So there was a lot of home modification that needs to be done. So if you ever need home visits to ensure that, your house is safe, to prevent falls, please feel free to also call us at that hotline number. I'll just flash it back again, and then we will address to you, we will assist you on that. Home care services, we do home care where there's home personal care, where we go in and then do wound management and stuff like that. So the active aging service is a program that my colleague runs. So last time we used to do a lot of community engagement. We go to CCs or RCs and give a talk, run various exercise programs for participants as well. So it was very active. It was an active arm of SATA, and we also do workshops like smoking cessation, diabetic management, managing dementia, managing depression, managing mental health. So there was a lot of workshops going on, and of course, with the pandemic, that kind of stopped. But now with the restrictions easing up a bit, we hope to also get back to that next year. So you can also watch out for that. So do follow us on Facebook, SATA CommHealth, or Instagram if you have. It's SATA CommHealth. And so there's 2 accounts for SATA. So one is SATA CommHealth and one is SATA CommHealth Rehab. So we do actually blast out our events, things that you want to join, and all the other various talks that's happening as well. May I know there is a branch at Jurong East? Is there the same as? Yes, that is correct. That is actually Jurong East, the one that's near, I think, Jurong Point, right? I'm not a very, yes, that is correct. That is part of SATA as well. Is there a particular service that you're looking at? Who gave me that question? Elena. Yes, that is part of SATA. Okay, if you were to see SATA's website, maybe I should have gotten that slides of where or how many SATA locations are there. Okay, let me just bring you to that. Okay, hold on. Let me just stop share. Okay, So you actually find out a lot about us here at SATA website. So if you were to see, we actually have various centers, right? We tell you we have doctors on wheels, home care service, rehab, the community hub at Fernville, like I shared just now, where Aspire took place. Yeah. So over here, and then we do have also subsidized care at our medical center. So I think one of the things that I need to also share is that despite the fact that SATA may appear to be a private or, you know, just like any other GP clinic, we are actually a charity. So what that means is that we do have funding for those of you who are financially who have financial difficulties to even pay for, you know, for what do you call that, for your healthcare service. So that is our stand or philosophy, that we try to help all our clients as much as we can. Hopefully with that, that will help you ease a bit in terms of getting healthcare services. Yeah. Okay, so everything is here. You can go in and have a look. They also tell you where we're at. So we're at various places in Singapore. Yeah. Esther, do you want to address that question? Where else is SATA available at? Esther or Jasmine? Yes, that's right. Yes, block 135. Yes, that is correct. You're correct, Elena. Okay, I'll stop share. Okay. All right. Any other questions? Hope you find this beneficial. Any other questions, guys, before I end? Because we are going to receive the guest of honor soon. Thanks, Elena, for your keenness to also check in on us. Hope to see you. Hope to see me. Where's the rest of everybody? Okay. Let me just check in when the guest of honor is coming, and then I'll be right back and update you guys. Okay, give me about 1 to 2 minutes. Hold on. Hi guys. Oh, thank you so much for your kind words. Thanks, Alicia, for paying attention. Lorena. Yeah, nice to meet you. Thank you, Sok Hoon. Okay, do you guys have any other questions about rehab? I can answer you guys because we're still waiting for the guest of honor. I think he's a bit delayed because of the rain. So you guys want to check in on other questions? I'm more than happy to answer while we wait for him. Is it about dementia? Let's take it something that's not related to falls, but you guys have burning questions about, like, you know, something to do with therapy. I'm more than happy to also answer that. You can ask me about dementia, you can ask me about stroke, falls, because all of these are also interrelated. Yeah. So if you have some burning questions that you haven't had somebody to answer, I'm more than happy to answer while we wait for the guest of honor. Camille, thanks for offering. How to volunteer? Okay, I will get Esther and Jasmine to get in touch with you. Could you just email us at media? Okay, maybe I'll just show that slide anyway. We do have a volunteer segment or volunteer department where it's under Dennis. So he is my colleague. So you can actually drop us an email just now. I think we put it as media. Wait, let me see. Oh yeah, Esther and Jasmine has actually addressed you. Volunteer at sata.com.sg. Thanks. My team is very supportive at the back. Yeah, so if you want to volunteer, we are looking for volunteers as well. Please feel free to drop us a note and share with us what would you like to, volunteer in, and then we'll get in touch with you. So volunteers, we do need quite a sizable number of volunteers because before COVID, if you were to notice, SATA actually was out and about in the community, and we run a lot of road shows. So we even have a Doctor on Wheels bus where we do a mammogram. And yeah, so we do need a sizable number of volunteers for that as well. So please, we are more than happy to have you on board as part of our team. Yeah. Okay, I see messages coming in. Right. Okay, for those of you who have missed the contact segment, let me just pull this up once more. Okay, here we go. All right, so for those of you who are keen to volunteer, please drop us a note at volunteer@sata.com.sg. Email-wise, mediacontact@sata.com.sg. You can give us a call for whatever needs that you have, and we can direct you to the relevant departments respectively. So it's 6244-6688, 6244-6688, okay? And I see questions coming in. Yeah, we are also happy to have you, Camille, to join programs for the elderly. It's a lot. So SATA Fernvale, or even for rehab side, I can only talk for rehab because that's my department, but I'm sure ops and other nursing services will also need it. We do run programs like cooking programs before COVID, exercise programs, screening programs. So it's always very busy at the active and the senior aging side. We will definitely need volunteers to help us to measure the blood pressure, measure attendance, registration, and yeah, so we're more than happy to actually have you on board, to be honest. Yeah. Okay. Any other questions I can ask? You guys can ask me about particularly anything while we wait for the G or H actually. It's about, dementia, stroke, any particular thing that you'd like to ask? Okay, maybe we should ask something more exciting. Have you guys had lunch? I haven't, so why am I talking to myself? Chat in can I have some responses on the chat box? Have you guys had lunch? Yeah. Eating while listening, great. I haven't had lunch. Okay, I'll only have lunch after this. Yeah, I'll have lunch after this. Had lunch, yes. Thanks, Shan Wong. I hope your lunch was good. Don't sleep, okay, after this. Quite an exciting few talks after this. It's quite a lineup this weekend with people from Australia as well as US dialing in online to actually give you guys this talk, which is so cool, right? Like you don't need, even through online, you get connections from all over the world. Hold on, let me just check again whether the GOH is here. Hi guys, thank you for staying with us throughout. The GOH is actually on the way. I think is the rain and is the traffic. Okay, Chan Wong, thank you. Chan Wong, I hope I pronounced your name correctly. Thank you for your questions. Want to learn more on exercises for elderly in their 70s, 80s? Yes, you can. I think what's upcoming next is, I think you can see from my slides. Let me see. Let me just bring you here. Future plans. We actually will have an online platform, videos and a YouTube channel that we will be partnering with Empower. Empower is another senior partner, community partner that we work with, where they offer a channel online to learn more about exercises that's specifically for 70s and 80s. I know that it can be hard because for 70s and 80s, their kind of exercises will be a bit different. I mean, yes, there are those who are very healthy, very fit, but of course, we need to modify certain things before somebody, before you can actually get there. What programs do you offer to dementia clients? Okay, we have a one-to-one occupational therapy client for dementia clients. So when you have persons with dementia, first of all, the therapist needs to assess to see what level or at what stage of dementia this particular person is at, because as you know, dementia is a degenerative disease and they come in different stages: mild, moderate, and severe. So if a person with mild dementia, we can run groups for them, which we have as well. Of course, currently we can't run groups because of the restriction of the pandemic, but it's called Dementia Group Program, where we run cooking classes for persons with dementia, because it's important to keep them engaged, to have sensory stimulation, and to actually enable them to be as independent as possible in their activities. So for moderate and severe dementia clients, it's a bit different, mainly because we have to see their behavior as well as their attention span. Because once you have moderate dementia or severe dementia, sometimes it's very hard to engage them in a group. So we tend to have it one-on-one, and we do have a quiet room in the center where we cancel out all the white noise, because that's very important, especially for persons with dementia, because they cannot have a lot of noise at the background that will distract them from a lot of things. So if you were to see dementia-specific facilities, they actually have soundproof rooms. They have lights to actually enable stimulation for them. So it really depends. So we do have such program. We do have one-on-one, we have groups, and then but what's most and we also do home visits, like I said, or home therapy, where we go in, because sometimes you do get patients with dementia or persons with dementia who refuse to come out from the house, and because they're very fearful. And they perform fantastically at home because it's the comfort of their own home and they feel very safe in their house. So it really, these are the various programs that we offer. Alicia, thank you for your questions. But like I said, it's really, really important to see where is this patient at in terms of their level of dementia. So, I mean, more than happy to also share our programs and with you, and you can actually check that out, I think, in our website as well. Jeffrey, thank you, SATA and Siti. Oh, welcome, very welcome. Welcome. So yeah. Any other questions? For dementia patients with a con, Melinda, could you explain a bit more what do you mean? For dementia patients with a con, what do you mean by that? I'm sorry, I cannot understand. Melinda Tan. For dementia patient with a con, what do you mean by that, Melinda? Could you share a bit with me? Oh, sorry, Sam. It's okay. All right. Any other questions about stroke? Bone mineral scan. Do I just call SATA directly or make an appointment or need a doctor referral? Edmund and Jasmine at the background, could you want to answer this to Chen Wong?
Okay. I think you just call the hotline 6244-6688. They will put you in touch with the appropriate person. Hope that answers your question.
Any other questions? If not, Edmund, do you have anything else to add? Okay, so GOH is coming in soon. I'll just put up I'll just let Jasmine and Esther pull up from here. Okay.
Okay, thank you, Zubaidah, for your most informative presentation. Okay, dear viewers, if you would like to receive Zubaidah's slides, please send your request to the email address we listed earlier. I'll repeat it here: mediacontact@sata.com.sg. Okay, for other inquiries, okay, SATA CommHealth's hotline number is 6244-6688. Okay, right now, the moment you've been waiting for. Dear viewers, welcome to the opening ceremony of the SATA CommHealth Osteoporosis and Fall Prevention Festival 2021. Okay, we will be awaiting the arrival of the GOH soon. We'll update you accordingly. Okay, dear viewers, welcome to the opening ceremony of the SATA CommHealth Osteoporosis and Fall Prevention Festival 2021. Okay, it now gives me great pleasure to welcome the chairman of SATA CommHealth, Mr. Stanley Seah, who was appointed a director in June 2012 and chairman in June 2020. Chairman will deliver his opening remarks. He will then introduce our guest of honor, Mr. Tan Kiat Hao, Minister of State, Ministry of Communication and Information, Ministry of National Development, and advisor to East Coast GRC/GROs to deliver his opening address. Please join me in welcoming our chairman, Mr. Stanley Seah.
Thank you very much, Edmund. Well, first of all, welcome to the SATA CommHealth Osteoporosis as well as Fall Prevention Festival. Today, we hope to give you some ideas, some lessons to improve your lives. I think one of the big things about falls is that if we can prevent it, it's going to be much better. Now, before we go into today's details, let me give you a little bit of update of what SATA is. I think most of us will remember we started a long time ago in 1947. And back then, we were dealing with another pandemic. It was called tuberculosis. So fast forward 75 years later, we are also dealing with another pandemic today, which we've been extremely busy the last 20 odd months, like everybody else, helping to fight this pandemic. So what we did was that we provide testing at the dormitories initially. We also helped at the Singapore Expo. And then after that, once we moved into a different phase, we provided mobile vaccination to the seniors and also to the vulnerable. So all in all, it's been very busy 20 months for all of us, like everybody else. Now, because of all these efforts, our beneficiaries have increased significantly. If we look at 2019, we served about 40,000 beneficiaries. In 2021, we have 3 times the beneficiaries we served, 120,000. So this is continuing the tradition of SATA, serving the community, focus on seniors as well as the vulnerable. I want to touch a little bit about, every year, how many people actually fall who are seniors. It's about 8,000 a year. 8,000 seniors fall per year. Now, these are registered because they end up being in the hospital. So this causes a lot of anxiety for people because we all know that, the moment we fall, it's going to cause more headaches down the track. And then sometimes also become needed to be assisted on a day-to-day basis. So what we try to do here is that how can we prevent from falling? And actually, it's not too difficult. And today, you hear a lot from our experts, from specialists, our medical specialists, to dietitian, to therapists, as well as IT experts to see how can we use the modern technology, how can we exercise at home ourselves, how can we strengthen our bones, how can we strengthen our muscles, so much so that we may not have to have a situation where we're going to fall down, right? So without further ado, I would like to introduce our guest of honor today, Minister of State, Mr. Tan Kiat Hao, to open this event for us.
So, very good afternoon, Stanley, and very good afternoon to all our friends watching us online. It's my pleasure to be part of this very important event, Osteoporosis and Fall Prevention Festival. And I think this is a very important topic, even as we deal with the current pandemic of COVID-19. As Stanley has shared, the last 21 months, it's been a tough period for everyone, not just around the world, but certainly in Singapore. And also, I think, especially for our seniors at home. Many of you and your family members have had to deal with a lot of uncertainty over the last 21 months. The situation is rapidly evolving. We are dealing with a new virus strain, which mutates as well. And I think the most important response that we have is not just the vaccination and the healthcare support, but really the community support and the social cohesion that comes along with everybody playing our part in tackling this important COVID-19 pandemic. And I think in terms of our achievements over the last 21 months, I think has been very, very strong. Very good response from everyone playing our part. And I must thank all of you, especially our seniors, for being so resilient and being such a model for the rest of us. I know it's been a very tough time for all of you. Safe measures, restrictions in terms of gathering. And for example, I have a young son at home, about 15 months old, one is slightly more than a year old, very active, but don't really have a chance to meet our grandparents because of COVID-19. I'm sure many of you who have children and grandchildren face similar restrictions at home as well. So first and foremost, I'd like to thank all of you for your very strong support, and thank you for leading the charge in terms of keeping everyone safe in Singapore. Especially at a time where we are taking our booster shots, please, for those of you who have not done so, I encourage you to do so. Just walk in any center and don't need to queue up, don't need to pre-register and get your booster shots. So even as we deal with the immediate issues of COVID-19, I think there's another important issue which Stanley talked about, which is keeping ourselves safe, well, and also active in our golden years. And fall and osteoporosis is an important issue that we will think about. And I'm very glad that SATA has organized this webinar, this event, to get experts, doctors, and community partners to share about important tips that all of us can use, not just for ourselves, but also share with your friends and family members. And I think what I like to do today is also to encourage everyone, continue to stay safe and stay well. We are in a good situation in terms of COVID-19, but even as we deal with the immediate issues, please also take some time to pick up some very useful tips from today's festival, apply them in your lives, and share them with your friends and family. So stay well, stay safe, and thank you for having me today.
Okay, thank you for your most enlightening message, Minister. Our next item is brought to us from a senior citizens' health and fitness interest group that came together in October 2013 with the primary objective of encouraging senior citizens to age actively and the younger generation to invest in their health earlier in life. If any of our online participants find the exercises too strenuous, kindly follow the routine at a slower pace or simply observe as the team entertains us. Okay, please welcome Team Strong Silvers, who will perform a Tabata workout session together with our VIPs, Mr. Tan Kiat Hao, and the CEO of SATA CommHealth, Dr. Kelvin Hua. This will be followed by a talk by Mr. Robert Ho on fall mitigation. The necessary safety precautions will be taken during the filming of this video. As the exercise routine is rather strenuous, the participants will remove their masks but observe safe distancing during this session. I will now hand over the stage to Team Strong Silvers.
Okay, the first exercise is run on the spot, all right?
All right.
And 20-second rest for the first exercise.
Okay.
Ready, go. Up. The next exercise will be lunges, all right?
Lunges.
Yeah.
Okay.
20-second rest. Ready, go. Last one. And stop. The next one will be Russian twist, all right? You can sit down, all right?
Okay.
Okay. Legs on the floor and bend slightly your knee, right? Usually this way, okay? Ready, go. Oh, exercise. The next exercise will be squat, all right? Stand up again. Ready, go. Hand on the hips. Last one. And rest. Next one will be burpees. You can do a modified burpees, all right? You don't have to do a push-up.
Okay.
All right, this way. Okay,
Okay.
ready, go. Last one. Cut. This is the first set, right? You still got one more set to do.
Okay.
Is it okay?
All right. Oh, that's all right.
All right.
You have to lead us by example. So
Okay, okay, very good. All right. Ready, running on the spot again. Ready, go. Cut. Next one will be lunges again, right? Ready, go. Last one. And stop. Next one will be Russian twist. Can you please sit down? Ready, go. Exercise cut. Next one will be squat. Ready, go. Last one. stop. Next one will be burpees, the test. Ready, go. Last one. And exercise cut. Give yourself. Thank you.
Okay, thank you, Team Strong Silvers, Mr. Tan Kiat Hao and Dr. Calvin Phua. I would now like to invite Mr. Robert Ho to speak to us on fall mitigation. Kindly note that any queries from the audience will only be addressed by the presenter at the end of his talk. Please utilize the built-in Q&A function to pose your questions. Okay, I'll hand over the stage now to Mr. Robert Ho. Thank you.
That's good. Okay, good afternoon, everyone. How was the exercise session? Okay, just to introduce myself, my name is Robert. Okay, and first and foremost, we'd like to thank the SATA for inviting us for this Fall Osteoporosis and Fall Prevention Festival. Okay, so we'd like to share with you all some of our thoughts on fall prevention that you can actually do to help yourselves to prevent falls. Okay. First and foremost, I'm going to just introduce the team. Okay. Someone. Technical break. Be back with you all soon. Okay. Okay, here we go. Right, this is the team. Okay, basically Team Strong Silvers, right? We got together in 2013. Okay, basically the main objective for us is to encourage seniors to age actively, and of course for the younger ones to invest in health earlier in life. Okay, so today with us over here is Uncle Ngai, the one in the white hair, and Uncle Victor and Uncle Okay, so let's go on. Okay, basically for us, right, we do a lot of calisthenics, which is a bodyweight exercise, a lot of push-pull movements on the bars, as you can see there in the slides. Okay, so why we do calisthenics is pretty simple. We can do it anywhere, anytime, anywhere, even at home. Okay, the body is also trained as a system because it's basically all the movements are functional movements. Okay, and of course, most important in any situation, right, is if you can handle your own body weight, right, you are considered as physically independent, okay, whatever your age. And one thing is this, you can handle your body weight, chances of you being able to arrest the fall is a lot better, okay? All right, so how do we define a fall? Generally, we call it an event which results in someone coming to a rest inadvertently, okay, on the ground or lower level. Okay, bottom line is false accidents, okay? Okay, so what can cause falls? These are the things that are basically, it's of course your physical ability, that means your health conditions. Are you having any health conditions that could cause you to fall? Like dizziness, okay? Extrinsic factors like your surroundings. Is your house safe? Is it cluttered? All that kind of stuff. And situational. Are you engaging in unsafe behavior? Okay, that is, do you drink? And if you drink, do you get drunk? Okay, things like that. Okay, or do you follow your medication? All right, so that's situational. Okay, moving on. Okay, the thing about falls, right, is generally happens when your legs actually don't do their job. Okay, so that's how you actually end up on the ground. Okay, generally we'd like to think of falls as happening only to old folks. Okay, the truth of it is it happens to everyone. Okay, because accidents happen all the time, everywhere. Anyone can happen to even the best athletes. Okay, so that is why we really need to find ways to prevent falls from happening. Okay, so what can we do? Okay, generally we talk about strengthening ourselves. Okay, and most of the time we talk about strengthening the lower limbs. Okay, extrinsic, which is again your environment, is of course making it safe. Okay, which of course nowadays we talk about having elder-friendly home designs. Okay, and of course for situational, we would say behavior modification, in that we tell people that you got to really make sure you follow up on medication, things like that. Okay, and good habits, meaning like good eating habits and all that kind of things. Okay. Okay, so here, right, we see Uncle okay, he's exercising, he's doing some squats. Okay, and in the background, we see this auntie, right? Yeah, she's wheelchair bound, but she's also exercising. Okay, so you can see that for fall prevention, most of the time, right, people talk about lower limb exercises. Okay, whereas, right, for cardiovascular health, people will also include, doctors also include upper limb exercises. Why? Because if you're talking about being healthy, right, you just need to get yourself up to the right heart rate, that sort of stuff, to get your heart pumping, breathing, oxygen levels up. Okay, so it doesn't matter whether you're actually exercising your legs or you're exercising your arms. Okay, so you can see the whole body is actually involved in terms of getting healthy. So in the same principle, right, when we talk about fall prevention, right, we should also train our upper limbs. Okay, so as you can see in the picture, right, you can see the little baby. She's actually holding the toddler, right? She's holding herself up, okay, on the rings. Uncle Ngai, you can see him on the bar, okay? He's doing a straight arm dips, okay? So as you can see, right, push-pull movements again, okay? Our upper body, our upper limbs, they can actually support our body weight, okay? Push-pull manner, okay? And you can see here, there's a old lady from China. Okay, she's actually doing the monkey runs. So again, if you look at it, one thing you can see is she's actually supporting her body weight with her arms. Okay, so in the same principle, right, we can actually use our upper limbs to mitigate a fall. Okay, because imagine if you are out on the bus, okay, you got those things that you can hold on to. Even if the bus jerks and your arms are strong enough, you can actually prevent a fall. But if your arms are not strong enough, you are going to fall. Okay, because why? When the bus is jerking, your legs, probably you're on an unstable platform, so to speak. Okay, your legs may not have the amount of space to spread out. So what can you do? You can only use your arms. So that is why we would really suggest that you get your arms stronger. Okay, now the thing is, how do I train? Okay, all over, lots of places you can train here in Singapore. Okay, you have the gyms, okay, age-friendly gyms, okay, like Gymphonic, okay, and of course, your downstairs, your fitness corners, okay. You can just focus on push-pull movements for your arms, okay. These are very good. Work on your grip. See, all these things will help you if you come when you need a situation where you might actually fall. Okay, so really you can do it, you can train yourself. Okay, and this is actually a study that was done in Canada in 2017. I'm just sharing with you all, okay. But the main conclusion, right, is that when they included upper limb strength training, they found that they could bring the risk factors down. Okay, so yeah. Any questions? Would you like to take them? If there are no questions, then okay, you see Mr. Ng here? Yeah. Okay. Uncle. Okay, very so. Okay. So Mr. Ng later on he will join Mr. Uncle William. Okay. Uncle William will be leading you all in an exercise session. Okay, over at Bukit Batok. So Uncle will be going there. Yep, there they are. They're gonna start. You all can follow along. These are very simple exercises, but it's good for health and also just get you ready in the sense that so you don't fall so easily. So, hey Uncle, 带他们了哦。
Yeah.
Okay, start.
OK，大家好，我是李威廉William 教在我旁边的是王先生今天我们就是做一个运动如果在这做了你的就可以跟着王先生来做OK， 所以我们的运动最重要的就是不可以受伤不可以就继续受伤现在我们要开始了双脚腿前，你肩膀我们头颈下的运动头慢慢提高吊起来，等下颈下的空间就多了我想这90度这个这边也是90度就够了就够了90度其实整个头是可以做得很多的，但是90度就够了 OK 嘛1、2、3、4、5、6、7、8、2、3、4、5、6、7、8、3、2、3、4、5、6、7、8 OK 了现在肩膀我们就是伸这关于等等，然后就可以1、2、3、4、5、6、7、8然后回来也是1、2、3、4、5、6、7、8现在也是了1、2、3、4、5、6、7、8回来也是1、2、3、4、5、6、7、8然后从里面开始1、2、3、4、5、6、7、8把里面把头给开了1、2、3、4、5、6、7、8现在都照了沉下去收下来放在整个运动照1、2、3、4、5、6、7、8再1、2、3、4、5、6、7、8伸起来手往外面1、2、3、4回来5、6、7、8上下1、2、3、4左右5、6、7、8然后都整个拉下去1、2、3、4轻轻1、2、3、4 1、2、3、4，1、2、3、4，然后我们肩膀手就好了，转动我们身体的做下去，对对对，最后面去玩，做去玩一点，然后轻轻的，这个拿下去给它转，我们转这来，如果做轮椅呢，就不用转到90度，转45度就够了你再转到45度了，这个转到45度回来45度回来45够了。如果普通嘅機可以將到90度，可以90度，呢排開始啦，1、2、3、4，你將45度夠啦，再來啦1、2、3、4、5、6、7、8，所以整个我讲只是做给你看，其实它可以做到360度的，但是我做一次给你看了波兰空呢，將都為空呢，將都為空，所以整個就是說，這個我們老人家不用這樣，90度了腰，你看做了輪椅的40度，1、2、3、4、5、6、7、8就夠了 ，OK 了。現在我們要做一個sit up，現在最重要了，要回來了，要整個直線直線，因為你打開了，你上去就整個樓就受傷了如果直線下去，那就不會受傷重點就是了，心態不可以超過平衡它是掌握，它是放鬆，這個也是就是保持不彎，沒有駝背這個保持，這個這骨質，你就不用了，你就就要提我就上去，你就不用提上來了。1、2、3、4、5、6、7、2、3、4、5、6、7、8、3、2、3、4、5、6、7、8 OK 了现在我们做这个原地的抽筋重点就是头要比较高，整个头上去沉上去，然后呢整个头颈上，眼睛要看这个地方定住，你一头眼睛就不会动了將條筋整個將45度45度45度45度將整個45度將嗰種呢右腳打上去將嗰整個左腳打出去所以現在我們首先是什麼先45度45度首先出來第一手放上去第二只要拿上去腰就轉了，轉到整個手不動，到整個手就上來所以再來1、2、3個動作再來1、2、3也這個也是1、2、31、2、3 1、2、3 1、2、3 1、2、3你手也可以跟着做你找不到人可以1、2、3可以做1、2、3 OK 了現在我們做開始真的做了出來left wide left wide left wide left wide left left, right, left, right, left, right, left， 这些所以时间你坚持可以做多长，随便你了。我只是介绍给你看，是做长动作。现在我们做的这个，我在做一个太阳功太阳功首先要怎样放松放松，一只手够了放松，先放冲锋，1、2、3、4、6、7、8。1、2、3、4、6、7、8，肩膀1、2、3、4，后背1、2、3、4、6、7、8，1、2、3、4、6、7、8，1、2、3、4、6、7、8，1、2、3、4、6、7、8，1、2、3、4、6、7、8，1、2、3、4、6、7、8。1、2、3、4、6、7、8。1、2、3、4、6、7、8，1、2、3、4、6、7、8，1、2、3、4、6、7、8，1、2、3、4、6、7、8。做下嚟太陽都有按摩，按摩兩手，按摩，兩種手按摩起來，手按摩起來，隻手按摩起來，兩個分住嘅。然后臀部整个臀部的按摩好不好？现在我们在做这个单层呼吸肺大肠小肠中间肺在上面，大肠中间就是在椎骨所以先从肺开始往后，中间椎骨都大肠小肠我可以打住1、2、3、4呼进去，1、2、3、4出来慢慢1、2、3、4、5、6、7、8，1、2、3、4、5、6、7、8，1、2、3、4、7、8。这个可以你自己做，可以做10分钟也可以，5分钟也可以。人靠现在的前后，现在左右呼收在骨头里面呼，从骨头里面吸出来，收呼，吸，呼。吸，呼，吸，呼，吸，呼，吸。做好了，而家可以按摩单场9次，回来9次，这样就完了，谢谢。
Okay, here we are back at CC now. Okay, any questions that you'd like to put across to us? Hope you enjoyed the exercise session as well.
Exercise video be shared?
Yeah, okay. So can it be shared? Yeah, sure. We'll put it on Facebook if you guys want it. It's May, right? Yeah, sure. We can put it on our Facebook. on SATA's Facebook? Okay, SATA's Facebook as well. Okay, Melinda, you are asking how much does it cost to join Aspire, is it? Okay, we are not Aspire, we are Team Strong Silvers. Okay, so Aspire, you actually have to go on the website and ask them how much it costs to become a member. Okay, as for programs with dementia clients, again, we are an interest group, so we actually don't run dementia programs. Okay, so yeah, that one you have to approach your nearest active aging hub, okay, or AIC Silver, e-locator on AIC, the AIC web. Yeah, you can find the nearest center to you. Okay. Any more questions? Sorry? Oh yes, you also can call SATA to find out. Okay, because they also provide the dementia programs.
Healthy lifestyle.
Okay, healthy lifestyle programs then. Okay, any more questions? I'm still here.
Okay, if there are no further questions, thank you, Mr. Robert Ho and the coaches for your talk and demo. Mr. Tan Kiat Hao will now take his leave. Thank you, Minister, for gracing the festival with your presence. Many thanks also to Team Strong Silvers and Dr. Kelvin Pua. Dear viewers, thank you for taking the time to join us today. Please check out our other webinars today and tomorrow. For other inquiries, SATA CommHealth's hotline number is 6244-6688. Okay, hope you enjoy the rest of the event. Thank you.